many people know that physical activity is healthy, it has been estimated that over 20% of people worldwide do not get enough daily. Now, if that sounds like you, or if you fall into that category, you should try out the high intensity interval training. Did I hear you say fitness time? This is Fit and Well on iBrandTV, and I am Michelle Abanu. Glad to have you back. Like I said earlier, it is fitness time, and of course I'm with our fitness trainer for today, Diallo. Diallo is going to take us through high intensity interval training. Now, before we delve right into this whole training, tell us about high intensity interval training and some of its benefits.
Okay, so high intensity interval training, set of exercises put together mainly for people who want to lose weight quickly. So if you want to lose weight quickly, this exercise we're about to do is for you. Okay, so between these exercises, you work out for 40 seconds, because today we're going to be working out for 10 minutes. 10 minutes, maximum 10 minutes, I promise. Okay, so you work out for 40 seconds and you rest for 20 seconds. Remember, when you're losing weight, your rest time should be less. Okay, so I'll give you two benefits of HIIT workout. Apart from, you know, losing weight and everything, obviously it helps you with stamina and also helps you with flexibility as well. And for those who have diabetes, you know you need to reduce your sugar level. So let's get right into it. Okay, so guys, before we start, make sure you warm up. We'll start with stretching, okay? So we start this way. Okay, your hands up. Make sure you stretch properly to the right. Back to the middle. This way. The other side. Stretch our legs as well. Let's go this way. 3, 4, and 5. Sorry. 1, 2. Your hands down. Keep going. 40 seconds.
Do the easy one.
40 seconds. Come on, let's go. Let's go. Oh, nice. You're feeling stronger, yeah? Let's go. Let's go, guys. You have 15 seconds left. Come on. Okay, so now, guys, we're going to be squatting. Are you ready, Michelle?
Yeah.
So let's go for 40 seconds in 3, 2, 1, and go. Let's go this way. 1, nice one, Michelle. Let's go. 2, nice and easy. 3, let's go.
There's nothing easy about
Nice one. Let's go. It was easy, everyone will do it. Let's go, come on. And stop. So now we rest for 20 seconds, okay? So now, this is what we're going to do, okay? Michelle, this is what you're doing, this way. 1, okay? Working on your abs and cardio as well. Woo. Are you ready? In 3, 2, 1. 1, 2, nice one, let's go. Nice one, Michelle, come on. Nice one. Let's go. You're doing well. Just 5 seconds left. Let's go. And stop. So we rest for 20 seconds now. Catch your breath, guys. 3, 2, 1, and go. Top, top, nice one. Top, top. Be strong. Be strong. Come on. Come on. 10 seconds down. Let's go. Let's go. Strong. Nice one. Nice one. Nice one. Nice one. And stop. You have 15 seconds left. Come on. Come on. 10 seconds. 10 seconds. Come on. Push. 5 seconds left. And then you catch your breath in 3, 2, 1, and stop. So guys, let's do one more program that will make Michelle scream and be tired. Let's go. We're going to attack her now. So we're doing this very easy, okay, like we're running. Let's go in 3, 2, 1. Let's go, Michelle. Come on. Come on. Easy steps. 15 seconds left. 10 seconds. Don't quit. Let's go. Come
worry,
on.
I'm going.
10 seconds left. You have 5 seconds left now. And stop. Catch your breath. Drink some water. Try not to drink cold water, please. Thank you. take like room temperature. That's the best for you when you're working out. So guys, when you're doing this program, please, I don't want you to rush it, okay? If you're doing this, you're not working out. I need you to crunch and go down, okay? Crunch and go down. Michelle, are you ready? Let's kill it. 3, 2, 1, let's go. Up and down. Up and down. Let's go. Up and down. Michelle, let's go. Up and down. Up and down. Up and down. When you're working on your abs, make sure your rest time is not too long, okay? So now let's go for your lower abs. Are you ready, Michelle?
Okay.
So Michelle, this is what we're doing. This way. I'm going to be doing this. Okay?
Okay.
Michelle, just do this for me, okay? Up and down, up and down, up and down.
Okay.
Are you ready? So we're going for 40 seconds. 3, 2, 1, and we go. Let's go. Nice one. Nice one. It's going to hurt, but make sure you continue and finish strong, okay? Let's go, guys. 20 seconds left. It's starting to burn, but continue. Let's go. For your lower abs. We have 10 seconds left. Come on. We have 5 seconds now. And stop. We're going to be doing mountain climbers, which is for your lower abs, okay? 40 seconds. Nice one, Michelle. Try to bring it closer to your elbow. Nice. Keep your waist low, Nice one. We have 20 seconds left. Come on, guys. The last program, very easy. Very, very easy. It's for your core. This is for your core, okay?
Okay.
So you just hold this position this way. Legs out. Nice. Trust me, you have just 15 seconds left. 15 seconds. If you finish in 15 seconds, we'll buy you pounded yam. Okay, let's go. Keep your waist low. Come on. Just 5 seconds. Be strong, be strong, be strong. 5, 4, 3, 2, 1, and 0. That's lost like 10 kg, guys.
Summer body loading.
Summer body loading. Serious summer body. So guys, now that we're done, you always have to stretch. Don't forget to stretch to avoid cramps at night. Make sure you stretch properly. Don't be in a hurry to go and eat your pounded yam. Stretch properly. Let's go. 2, 1, and down. Let's go. Do the same thing. Nice one, Michelle. Let's go. Now your right hand up, left hand on the ground, and push with your elbow. Push it, 3, 2, 1, and stop. 2, 1, and muchos gracias.
It has been an exciting, a great workout session. Now it's over to you, Perpetua, on the wellness segment.
Diabetes mellitus is regarded as a chronic disease with high incidence, and it is also one of the conditions of public health importance. According to the World Health Organization, WHO, 1 among 10 adults had been diagnosed with diabetes mellitus. Based on a report by the International Diabetes Federation in 2013, there were 3.9 million cases of diabetes in Nigeria, which was the highest prevalence rate in Africa. It has also been shown that 80% of deaths by diabetes occur in low and middle income countries, and by 2030, diabetes would be the 7th leading cause of death. Furthermore, studies have reported that the prevalence of diabetes mellitus in urban centers like Lagos and Sokoto metropolis to be 7% and 4.6% respectively. A prevalence of 11% was also reported by another survey conducted in Lagos City. A review conducted in 2017 reported the prevalence of diabetes mellitus in Nigeria at 5.77% and that urban dwelling was identified to be a risk factor. Thus, it has been suggested that diabetes mellitus could be classified as a disease for the high-income or urban dwellers. Majority of available studies conducted in rural areas have reported low level of prevalence of diabetes mellitus. A survey by Sabir et al. In a rural settlement in northern Nigeria reported a prevalence of 0.8%. A report by the Federal Ministry of Health and Social Services also reported prevalence rate as low as 0.65% in Mango rural settlement, northern Nigeria. However, findings from a recent survey by Argu and Maduka in a rural community in Delta, southern Nigeria, revealed that there was an 8% prevalence of diabetes mellitus in the community. Alcohol use, exercise, age, diastolic blood pressure, and family history were identified as factors associated with the disease. Experts have averred that tackling this emerging disease in Nigeria would require continuous monitoring and assessment. Unfortunately, it has been reported that there is a paucity of research that assesses the burden of diabetes mellitus in Nigerian communities.
Thank you, Michelle. Thanks for joining us on the Wellness segment. I am Perpetua Fasomi Peter. Diabetes mellitus is a chronic disease requiring lifelong continuing care. Most cases of diabetes can be broadly classified into two categories: type 1 diabetes and type 2 diabetes. Type 2 diabetes mellitus accounts for the vast majority, that's about 90 to 95% of persons living with diabetes. Diabetes mellitus is associated with acute and chronic complications which reduce quality of life, result in disability, and lead to premature mortality. Diabetes and its complications can result in considerable financial costs to people with diabetes and their families through direct medical costs, loss of work and wages, with a significant toll on economic productivity. Joining us on this conversation is consultant family doctor, Dr. Odia Enaholo. Hello, doctor. Good to have you on board.
Good afternoon, Perpetual. Always a pleasure having you.
Thank you.
Thank you for making me be able to reach out to teeming populace who need this medical information.
Absolutely. Now, the layman thinks diabetes is caused by the consumption of sugar-laden foods and diet. How true is this?
There is some truth in it.
Okay.
Because one of the risk factors, one of the risk factors to having diabetes is not having a proper diet. So having an inadequate diet that is especially riddled with sugars, the unprocessed types, puts you at risk of diabetes. But diabetes goes beyond that. It is quite different from what the layman thinks. Diabetes is a metabolic disorder, and it simply means a deficiency of insulin, which is a hormone that is produced in the body. So when we have this deficiency of insulin, what happens is that we have excessive glucose in the blood. Insulin is supposed to utilize the glucose so that the body can make use of it. But because insulin is deficient, we now have excessive glucose. So we can just simply say diabetes is a disorder where the blood glucose increases.
There are about 3 types of diabetes. However, we would like to focus on type 1 and type 2 diabetes. What are the causes or risk factors of these types of diabetes, starting with type 1?
We basically have 3 types of diabetes now. We have the type 1 diabetes, we have type 2 diabetes, and we have gestational diabetes. These are the three basic types of diabetes. There is equally the concept known as pre-diabetes. I'll delve into that, but it's not a type of diabetes. So type 1 diabetes is insulin dependent. It used to be known as insulin dependent diabetes mellitus, or juvenile diabetes, or childhood onset diabetes. So I'm sure that's where you got the categorization of 5 from. But it's now all classified as type 1 diabetes. So in type 1 diabetes, what happens basically is that the body, or the pancreas, which is the organ in the body responsible for production of insulin, is unable to produce insulin. That is what happens in type 1 diabetes. So therefore, but it occurs early in age, early in one's life. So usually we find it in children. That was why it used to be classified as childhood onset diabetes. We find it in young juveniles. That's why it used to be classified as juvenile diabetes. But the basic thing occurring at this point is that the body doesn't produce insulin. It therefore means that treatment for type 1 diabetes has to be with insulin alone. So type 2 diabetes, on the other hand, it's diabetes that is caused by a relative absence of insulin. Okay. In this case, the body produces insulin, the pancreas produces insulin, but the receptor cells, which would open up for this insulin to be utilized, are deficient. So there's insulin in the body, and the body cannot use it. So there are medications that have been designed which will open these receptors so that insulin can therefore go into where to be utilized. So that is the difference between type 1 and type 2 diabetes mellitus. That type 2 used to be known as adult onset because we find it occurring more in the later part of life. So these are the two major classes. Then we have a third one known as gestational diabetes. Gestation, as we all know, it's related to pregnancy. So a pregnant woman who develops diabetes only during when she's pregnant is referred to as gestational diabetes. I'm not saying that every woman who is pregnant will come down with diabetes, but it occurs only during pregnancy.
Thanks for the explanation, doctor. Now, what are the risk factors?
Okay, so generally, risk factors for diabetes include things that we do in our daily living. Where overweight, it predisposes us to having diabetes. If we don't eat the right diet, and we have a lot of junk, we have a lot of sugars, we have a lot of over-processed food, it predisposes us to diabetes. If we do not exercise adequately or frequently, it predisposes us to diabetes. Smoking, again, it's a huge risk factor. Alcohol consumption, it's another huge risk factor. So these are some of the risk factors to having diabetes mellitus. Excessive weight, poor dietary lifestyle, smoking, alcohol consumption, then of course, the genetics that are involved in. So if you have a relative who is diabetic, it means you are at risk of diabetes, especially when all these other risk factors are not checked. So these are some of the risk factors to developing diabetes mellitus.
From the risk factors you mentioned, one can almost tell what a preventive measure should be, really. Can you share them with us anyway?
Exactly. The prevention, it's a reversal of these risk factors. It's a reversal of these risk factors. So talking about weights, maintaining the appropriate and adequate weights would cut down the likelihood of developing diabetes mellitus. There's a way our weight is assessed scientifically. We calculate it by assessing the BMI. BMI stands for body mass index. It's actually a function of our height and our weight. The ideal body mass index is between 19 to 25. So anybody above 25 is overweight. So if you must prevent diabetes, you should ensure your BMI is within that normal range. Then healthy eating, cut down of excessive carbohydrates, over-processed food, fat and oil. Just ensure basically that your diet is a balanced one, as well as taking a lot of water. What should form the basis of your meals? It should be lean protein, fruits, vegetable, then carbohydrates sparingly. This will cut down your risk for developing diabetes. Exercise as well. It's another prevention. The method will usually advise to patients or people who are at risk of developing diabetes. Free insulin resistance, and exercise has been shown to delay the onset of diabetes. And we recommend we do at least 30 minutes of moderate intensity exercise, at least 5 times a week. That's, if you follow that through, it helps cut down the risk for diabetes. Then, of course, smoking cessation and cutting down of alcohol. So these are some of the things you can do to prevent diabetes mellitus from developing.
Now let's talk about people who are already living with diabetes. How is it managed or treated?
Okay, so it's important for us to mention here that diabetes mellitus, once it starts, it cannot be cured. What we mean by cure, when we use the term cure, it's a total clearance, even after cessation of the intervention that has been provided for the disorder. Just like you have malaria, you take an anti-malaria, it clears the parasites. So except you come in contact with the parasite again, there's no need for you to continue to use the medicine that was used to treat malaria. But for diabetes mellitus, we don't achieve cure, but it can be well controlled.
Okay.
So for type 1 diabetes, like I alluded initially, insulin is the mainstay for treatment. The patients are placed on insulin for life, and it's titrated against their blood sugar. So at each point in time, they see their doctors, they adjust the dosage, but they are on insulin. So for type 2 diabetes mellitus, treatment depends on a lot of times it depends on the level of blood sugar that the patient presents with. If it's still very, very in its early stages and it's still mild, diet and exercise are the main modalities we employ. We just ensure we correct the diet for that patient. The patient is usually referred to see a dietitian, and low glycemic diet is usually recommended. We just ensure the patient has a lot of fruits, a lot of vegetables, water, and lean meats or fish. These are some of the things that are recommended by the dietitian. And once that calorie restriction is enforced, it helps control the blood sugar. Exercise, again, which improves insulin resistance, it's equally another strategy that is employed in the early stages or when we have a very mild disease in diabetes mellitus. When all these measures don't achieve the reduction we want, we can introduce oral hypoglycemic agents. Oral hypoglycemic agents are the general name we use for medications that are used to treat diabetes. We have different types of these agents, but they are tablets that are given to the patient and they drop the sugar for the patient. For some of the patients with type 2 diabetes, they can equally be given insulin. So diet, exercise, oral hypoglycemic agents, and insulin are some of the treatment modalities that are used in the management of type 2 diabetes mellitus.
People living with diabetes usually come down with some very serious complications like limb amputation, loss of sight, and a lot more. What is responsible for these, and what are the other complications they are prone to?
Okay, so because of the complications that come with diabetes, which are numerous, we preach and we teach early screening, early detection, control of weight, the right diet, so as to prevent the onset of diabetes in itself. A lot of times, the patients do not even know they are diabetic. And it's important at this stage to mention some of the symptoms patients who are diabetic will have. Patients, there are 3 classical symptoms. Frequent urination, you find out that you are urinating more than expected. You should suspect it could be diabetes. You find out that you get very, very thirsty. Polydipsia, you could be diabetic. Or you find out that you are eating more than you are supposed to, polyphagia. So these are some of the classical signs. So diabetes, because it's a metabolic disorder, impacts on every part of the body. It impacts negatively on the eyes. Diabetes can cause blindness as a result of diabetic retinopathy. It impacts negatively on the kidneys. It can shut down the kidneys as a result of diabetic nephropathy. These are complications that diabetes mellitus presents. Diabetes can cause loss of limbs because you will have a wound that refuses to heal because of the impact diabetes has had on the nerves and on the blood vessels, because it causes angiopathy, it causes neuropathy. So healing process is usually very, very poor. That is why we preach early detection. And that is why we preach a healthy lifestyle. If you pick up diabetes early and your treatment strategy is just maybe modification of your diet and exercise, that will cost you almost next to nothing. But if you have allowed the disease progress to the extent that you will start requiring medications, that you will start getting shots of insulin, or you've developed complications that requires amputation or makes you blind or impact on your health negatively as a breadwinner of the family, the impact is huge in terms of finance. So early detection or early onset of taking care of your diagnosis will help reduce the financial burden involved with the attendant problems that comes from all these various complications that we have talked about. In addition to treatments that would cost him for the amputation, for his daily medications, for his insulin if he's placed on insulin. So early detection, early management of your disease will help reduce the financial burden involved in all this dynamics we just discussed.
Those are very serious complications, and I believe that is why prevention is important, and I like that you stress that. Thank you so much, Dr. Odia. We had a great time listening to you.
You're welcome. Thank you so much.
It's a wrap on this segment. Thanks for watching. I am Perpetual Fasomi Peter. Back to you, Michelle.
Great job, Pep. That was really informative. Guys, we have come to the end of this episode of Feed and Well on iBrandTV. Till I come your way next time, I am Michelle Abanum. Bye for now.